All right. And for those that are not here today as well, we'll send, those are here today as well, we'll send a link to a recording for the session, so that can be shared. And it will also be available on our website in a few days. All right, I think we should probably start from now, shall we? All right. Welcome to this masterclass, Digital Patient Pathway for Beginners. My name is Guillaume Leroux. I'm a Customer Success Manager at Personify Care and a registered nurse by background. We'll start first by doing an acknowledgement to country. I'd like to acknowledge the Ghana people, traditional custodians of the land, which I gather today, and pay my respects to the elders past and present. In the spirit of reconciliation, Personify Care acknowledges the traditional custodians of country throughout Australia and their connections to land, sea, and community. We pay our respect to the elders, past and present, and extend our respect to all Aboriginal and Torres Strait Islander peoples today. Now, today's topic, Digital Patient Pathway for Beginners. Today. So before we get started, just a few housekeeping notes. As I said, if you have any questions throughout the masterclass, please type them into the chat box so we can have a look. And we'll also put a question in the Q&A box a little bit in a few minutes. I'll try to do my best to keep an eye and answer them on the go. But as Tessa mentioned, you can please don't hesitate to unmute yourself to say, oh, I just have a question about this. Can you repeat or go a little bit slower? I really like that because it needs to be interactive, right? So I don't forget that you're there and you're live and can interact with this presentation right away. Yeah, so I see that some people have put a little bit of things on a little bit of message on the chat. Please don't hesitate to say hi and where you're calling from, and maybe what did you have for breakfast as well. I know I rarely have breakfast in the morning, but it wakes me up better with a coffee, and I have breakfast a little bit later then. All right, and as I said, yes, this will be recorded. We'll send you a link a little bit later. Hi, Michelle from Melbourne. Very nice, darling. Thank you for coming. All right, let's put in a question in the Q&A area. So it's a question as well. Have a look. Answer live. So this is mainly type answer. This is open. I think this is mainly for you. I can't actually put a question in my Q&A area. I'll put it into the chat there, right? Have a look and answer if your heart's desire. I'd like to know a little bit more about your challenges in the patient journey in your organization. Is there any specific pain point that you already know that could make your experience as a clinician and the experience of your patients or the experience as a health service organization better in that interaction between patient and the health service? We'll have a look at those answers a little bit later, just before I start the practice and building a digital pathway via our system. In the meantime, all right, let's go through a little bit of the theory just to overview what is the digital patient pathway. So digital patient pathway is a digital patient journey that is actually designed in general by clinicians to fit communication and interaction points between the patients and the health services. In general, right, this can be anything that happens before the patient is face-to-face with the organization or with any clinician wishing to engage in that care and relationship. So it could include, right, forms, surveys, maybe just simple questions that need to be addressed, PDF documents, Word documents, letters, images, videos, and most of the time as well now hyperlink, trying to get the patient to read things on website where they show evidence-based documents or instruction about certain procedure, things like that. It could be video, right, from from YouTube that you want the patient to read at the same time, a document that's another website, plus a question that you all want included. And then usually it's much better to do this face-to-face because it's very difficult to actually do this without interacting with the patient. So you can see that I'm being very broad here on the purpose, because obviously every customer, every health service has got their own needs in terms of what they need to provide and what the information they need from the patient as well to come back to them. And those can include rights depending on the pathway, right? Those documents are relating to maybe surgical, could be discharge hospital at home, could be maybe you have some things you need from your patients for specialist clinic or IVF clinics, outpatient space, or even sometimes from the inpatient space, could be from family or things like that. So Sarah just mentioned in the chat window just above where you're tapping, there's a drop down that gives you the option to message just the host or everyone in the webinar. Yes, just in case you'd like to switch between the two options, don't hesitate to send me a message directly if that's your preference there. All right, so digital patient pathways, right? As well, they are supposed to be patient-centric. We need to make our health services designed around the patient. So it needs to fit their need. It needs to be personalized. It needs to be very easy for them to complete. And there's no loss into, oh, the option here was too complex and I ended up in a place that is not for me, right? So it's designed for the patient in mind, but also designed, right, to fit clinicians' workflow, because there's a very complex interaction as a clinician. And so you want to get information at appropriate time in the clinical workflow as well. I mean, for the patient, it needs to be seamless, right? It needs to remind them whenever there's something new, and it needs to be as simple as possible, right? That's there's one or two things to complete, and then that it's clear that it's completed. And then after that, maybe there's a little bit more information over time for them to complete. Yes, and then we'll see that especially with our system is that we have the ability to actually create automation in there. So that means that we can actually trigger very specific information to very specific type of patient needs based on clinical decision, or sometimes as well a patient answer to a survey. For example, like if you have two patients both having a knee surgery, but you have a different level of monitoring and preparation depending on their pre-existing risk factors. So if one has high BMI and a cardiac history, for example, then you could be triggering information for that patient that the other one won't see automatically within systems. All right, so I'll talk about this a little bit, seamless for the patient, patient-centric. Now, some benefits, right, of having digital patient pathways. We can see some data here from one of our case studies, but big part of the value we had to health services is the ability to review patient surveys, answer by exceptions, right? So we do that by allowing clinicians to set up flags that will trigger upon their specific needs. So for example, if you have, the most obvious COVID-19 screening survey that's going to every of your patients before coming to an appointment, you can set up the specific flags that you want for each specific answer that a patient would give, right? You give them a yes or no choice. They say, yes, I want a flag on the yes answer. That means that you can actually just trigger some flags on the patient that have, clinical risks, and ignore all the other patients that answer the survey that do not have any of those clinical risks. So it means that in some situations, depending on the number of flags and the survey that you're actually providing to your patient, you can save, a large part of your workforce reviewing each of those surveys. In some instances, we see up to 80–85% saving time on sort of the survey, especially regarding COVID-19 screening. So this allows, right, improving existing processes and creating efficiencies with clinicians, removing the barriers to, the core nursing activities, which is caring for the patients, because a little bit more time now that is giving back to those teams to actually help out more patient and the patient that needs more attention. You can also, enable clinical staff to detect the patient risk and the complication much earlier. If you get a patient to answer a survey, days before they actually need to answer it, or health assessments weeks before they actually come for an appointment, you can actually have more time to prepare for their coming admission and appointment. And therefore, as well, we can see that translates in some instances in quality and safety improvements, right? So that means you can actually say, or maybe we can decrease same-day admission cancellation. We can improve booking of room more efficiently because now patient actually have a feedback to say, yes, I'm coming to the admission. No, I'm not coming. I've got a risk for infection 3 days before appointments. Clinician have the time to rebook rooms much earlier than currently doing via phone calls. Question from Michelle. Victoria, we have a devolved system of governance resulting in multiple different EMR systems in use. How do DPP integrate with EMR? Very good question. So in general, right, DPP, we're talking about digital patient pathway. With our system, we've really built Personify Care from scratch to be able to integrate with to EMR, right? We've designed the system as it's not an EMR. We're not here to create another silo of information where things going to live in Personify Care and it's not going to go anywhere else. The ultimate goal is always to integrate to an EMR so that every survey, every information that's done into our system actually flows back to the EMR, which is the source of truth. We've done a number of integration with existing systems across Australia, and that really goes into different steps, right? In general, what we really like, because in Personify Care, we can implement a digital pathway very quickly. We're talking about weeks here from the moment, the contract is signed and you're ready to start your patient journey to the moment you invite your first patient. We have a 4-week onboarding process that I'll demonstrate in a few minutes. And we can go even quicker than that. So in general, we recommend to start designing pathway quickly. Try to find value with your digital patient pathway that give back this value and time to your clinicians. And then if you see that this actually gives value to you and your patient and your clinician, then after that, the long work towards integration with IT can start. And we can see that this takes a little bit of time, but you already have a return on investments from going live with patients. That motivates as well, in general, the investment that is needed to do integration with the EMR. Another question, what's your team's biggest challenges with the patient journey in your organization? Yes, question to audience. Thank you, Emma. Just repeating question here. All right, some of the common misgiving and challenges for digital pathways about change management. As I said, actually just mentioned it, right? Pathway implementation, it follows usually what we do in the onboarding process to follow existing patient and clinician workflow. As a clinician, it's one of my expertise to actually understand what's the current workflow that's being done between clinician and patient, what are the current forms and interaction points. And then we design a digital patient pathway that mimics this same exact process between clinician and patients. Also, that means that the aim here is to reduce the current practice load and not change the process, right? Because changing the process, then people are lost into, the new process, new technology, everything is new. There's a lot of instances that takes months and sometimes change manager and project manager to put in place those things. So for us, it's very easy to say, keep the process in place. We'll mimic that process by digital forms and digital documents. Try to find high value points interaction that can be automated with the system. And then after giving back this time to clinician and administrative staff, so that with this time, then you can see, right, now we have a little bit more time in this valuable, we can actually change the process in place to make it more effective so that the change management to use the technology is as small as possible. And that allows us to go live, within 4 weeks or less. We've done, within a few days with some customers as well. Another misgiving, common misgiving is older patient cohort, right? So of course, every team has got their own type of patient cohort. Every cohort of patient is unique. And, we can say that older patients, right, it's a common misgiving that they won't use technology or they can't use it. So what's true in there is that it's 100% true that we'll never get all patients using technology, right? There's instances where, you know, vision is impaired or arthritis of the fingers, very difficult to use either computer or mobile. This is not going to work for everyone, that's for sure. But what's not true is actually that most older patients won't use technology. So we're using, you know, a system to deliver, you know, activities to millions of patients. So we've reached about 7 million in the last 12 months. And we have, you know, very wide range of demographic, up to over 100 years old of patients is also using the system. And also to allow some patients that don't have a mobile or have difficulty with mobile, we also have the ability at Personify Care to actually allow the patient to elect a proxy that's going to be able to complete those forms on their behalf. And it's very clear for the patient and for the clinician who is entering the data into the system and who the patient is as well into the system. And that allows, right, us to have, you know, between, you know, 70 to up to 95% of invited patient to Personify Care to actually complete an account and register an account and complete the task. And we have over 90% of all activities that are created via Personify Care that are completed by patients. So that means a high number of patients, you know, create an account. And then once they create an account, a very high number of those patients actually completing all the tasks that are being given to them by the health services. And last, I think as well, the last misgiving, not that much on the cost here, but is mainly we've had feedback about, you know, is this going to impact my relationship between me and the patient, right? I don't want this healthcare to become this automated things where no one talks to each other. And that's exactly not what we want as well. For us, I think in general, we can see a system like this like an enhancement of the patient-clinician relationship, but that if you can get a high number of patients to actually, you know, read documents and fill forms on their own time when they choose it, and then that gives more time for the clinician to actually call and interact with the patient that won't use the system, who actually needs further investigation because their case is too complex. That actually increase, you know, the time and the benefit for both the clinician and the patient, because clinicians have more time, they have more patients, they decrease their burnout actually at work to filter all the patients. And they have the time to sit there and say like, I've got an hour to talk about the things that's happening to you. Let's have a look. Any questions, any feedback regarding what I've just spoken about? I'm conscious I'm going sometimes a little bit quick and talking a lot, so I'll take a little pause there. How are you doing? Thank you for the questions so far. I think, I can see the Q&A. Oh, yes, I need to open my Q&A. Thank you. All right, let's see some of the questions here. Very helpful. Michelle, what control does Personify Care have to mitigate against the risk of cyber attacks? Very good question, Michelle. Thank you very much. So at Personify Care, we're a software in healthcare. Healthcare has got one of the highest standards for cybersecurity in terms of patient data protection, and we are very proudly, you know, following all the guidelines that are needed in Australia to fit into the certification for holding patient data and making them secure as well. What I'll do at the end of this webinar is everyone that would like to actually try the patient experience can be invited. So I'll invite you to the patient experience we'll create today. But we have Ivan Pesky, our CTO, present here, and he has raised a hand. I'll leave Ivan take the audio for a second if you want to say something.
Yeah, I was just going to say a few more words on that. If you would like, we do regular external penetration testings around what the system was, the standing in the system, and making sure that everything works correctly and there's no vulnerabilities. We do regular checks on any known issues, and we update the system daily if there is any findings out of that. So in general, we spend a lot of time and effort in making sure that everything is secure. That's one of our utmost priorities. We do know that we're holding information that is very sensitive, and we do our best to make sure that that is taken care of appropriately.
Indeed. And I think on that note as well, I want to explore too much unless you have more question on this, but the data held in Personify Care is our customers' data. We don't hold this, we don't have any ownership over it. It's really our customers. They own the data and they can do what they want with it. So we respect this as much as the law, and the law is very strict on this as well. So yeah. On the website as well, there's a little bit more information if you want to have a look at our privacy and security statements. This is available via our website. All right, let's progress to the next step. So before going into the practice of building a patient digital pathway, I want to just put a few words into our onboarding process. This is important because into the practice, we'll go through a factis type of case to build a simple patient digital pathway. But the secret here is in the sauce, right? We need to actually have a clear and simple onboarding process so we understand what is the need of our customer and we can deliver as much value as possible and as quickly as possible as well that fits their specific needs. But in this, I'll touch briefly on the role of customer success manager on this. So customer success manager, my role as, I'm a clinician by background. I've got about 10 years of experience as a pediatric nurse before working for Personify Care. But my role here is really to provide a great experience at highest value possible from our product. So I want to understand what our customer want to solve, and as well give as much value from a product for what they can get. I'm also a product expert, right? So that means that I need to understand the manual process, digitize the documents and the forms, and then creating the best possible engaging patient and clinical experience using the platform. Basically, right, during onboarding process, we do the hard lifting of you during this 4-step onboarding. We take your existing paper form, digitize them, set up the platform notification, and design the patient journey, which fit your existing patient workflow. Then we review this with our customer to make sure that it's really fit for their purpose and they're happy. We train them to actually review all the text and modify themselves the things in their pathway. And then we train the users to actually start managing the patient within the platform as well within the 3rd week. And we let as well get as many user feedback from the platform before going live, so that our customer can actually invite as well patients and users and family members that give feedback about this patient experience, and to modify those things before we go live. And as I said, right, our customer can modify themselves their pathway, and that's a big part of our software, is that we give the power to our clinician to actually change their pathway before going live and after it's gone live as well, because it's platform. You see that's a click and drag interface. There's no coding. It's really simple as to, oh, there's a typo there, changing typo, clicking save, and then this new version will go to your patient then. I will start demonstrating. I'll just have a question here from Alison. Is Personify predominantly acute care or chronic disease management? So very good question. So at the moment, there's no specific health service that we specialize in, because what we specialize in is patient interaction, patient engagement, and delivering what a customer actually are currently delivering to the patient. So we have a large number of our customer are around the surgical space, because this is an area where there's acute interaction between patient and their patient. But we also have customer in the research space with clinical trials going on for a year or 2. We have some clinics that's using our system to get a patient coming for a consulting specialty. We're starting to be live as well in cancer space for PROMs in the research and the acute phase area. So really, it's really about what are you currently delivering to your patients. That's, when the patient is at home, what do you need from your patient when they're not face-to-face, or were you trying to collect via phone call? we can help you in any of those stages. We have a clinical trial as well that's trying to encourage patients to action, their health needs in the prehab, so before coming to surgery. So we're talking maybe trying to change habits and engagement of health habit in a chronic space. So it's really about what currently are you doing? Are you phoning a patient trying to get data? And can a system like this help you save some of the time and delivering the things to your patients, in the comfort of their home? Any other questions before I start the demonstration? No, not a problem. I think that on the question as well that I posted a little bit earlier, so what's your team's biggest challenge in the patient journey? I think I've touched on some of those things, right? This patient interaction, or sometimes as well is getting patient to prepare before an appointment or before a surgery. Right before a patient, some patient need to do an X-ray or need to have some bloods done before they come. And there's a big issue for some of our customers that, 30–40% of some patients actually come to appointment unprepared. And that means that they come in and, well, they're not gonna cancel this appointment and reschedule after they actually done their X-ray. So that's something that can be reminded. You can even ask the patient, have you done your X-ray? 2 days before they're coming, and if they say no, then you can cancel or rebook that appointment to have a more efficient type of appointment. Informed consent, yes. We have a special feature that do financial consent, so that every patient gets individualized form that is with their numbers, and we even have a feature as well that a patient could even pay via our system after seeing and signing that informed consent. We're doing now as well medical consent via our platform, and that means that the consent itself is the administrative part of getting the patient to read their risk, read their specific needs regarding a procedure or an intervention, and then signing that they have received information. Most of the consent, and I think there's a lot of discussion around this, we're not a replacement of the patient-clinician interaction. The consent is always something that needs to have a conversation between doctor and the patient, but we're helping out into the patient being able to say, all right, now I have this interaction. I can now go home, have a read again of those risks via a digital form, and signing it when I'm satisfied and happy and I've discussed it with my family members. And that means as well that it might be signed a few days or even a few weeks before the patient comes for surgery, procedure, or intervention, which is a big improvement from most of the interactions sometimes now that most consent are signed just before the patient goes into to the room. In answer to the question, let's have a look at the question page. Can't wait to hear more about measuring impact at the hospital and at HN, which naturally includes impact for patients. Thanks, Ivan. The hospital and HN. What does? Yeah. All right. Cool. So I think that everything has been pretty much answered. Let's dig into the practice. Can Personify Care export data into research database such as REDCap? So I've never heard really of REDCap itself. We integrate, right? We've designed integration as part of a feature that we know we have to do with all of our customers. Now we have REST APIs, which is an other type of integration features. Sometimes it's really about seeing is the other system as well designed in a way that it can really integrate. And those usually conversation comes after that. As I said, we know the customer knows that we're already delivering value for them, and so like, all right, now we know it's useful. Let's do a little bit more IT work, or a lot more IT work to integrate and get even more value to a system like this. But the question is, it really depends on REDCap, but we integrate with all systems that have those integration interface. All right, if there's any more question or you want to add something on this, Ivan, as well, I encourage you to open your mic as well.
Yeah, in general, we can support integration in a number of ways. One is through the REST API, as Guillaume mentioned. Other ways are we can design reports for you to be able to export straight from the system into different formats. some of the more common formats like CSV and so on. As Guillaume said, it really depends on what that other system supports, but on our end, we do work with you to make sure that we provide the data in a way that you can use it with other systems. We're really open to integrations, and it's something that we believe in. Data should be, it is yours, as we've stated before, and we do our best to give it to you in a way that you can use it.
That's correct. So do you have integration in practice managed software such as like Genie? So I know we have not integrated with Genie so far, but as said as well, this is kind of a two-system discussion. So we've designed ourselves to be able to integrate with most systems. For example, we've done integration with My Health Record, so we can send discharge summaries to My Health Record. And we have other number of systems such as Track Care that's also being used across a lot of hospitals in Australia, but Genie itself, not yet. All right, I will start going into the practice area. So now we've touched a little bit more about what a digital patient pathway is. I want to give maybe a 20-minute, 25 minutes into designing a pathway experience. So I want to show you how easy it is, and also give you kind of a little bit best practice in terms of patient engagement of what a digital pathway is designed for and how it can actually deliver value for both the patient on one side and the clinicians on the other. And don't hesitate to send question again. We'll have a little bit more time as well at the end. We can go a little bit further on if you have time, and you can address some of those questions. It's not really directly related with the practice. All right, so let me share my screen here about this. So now I'm gonna bring you to the Personify Care experience, and what we'll do today is we'll start gonna create a pathway from scratch. And we'll take the next 25 minutes to design a pathway. I've got a little cheat sheet here available, so I can make this a little bit quicker. We'll go through the different steps and explain the different things that I'm putting in there to show you, what the patient experience looks like, and as well how we can design, for example, flags and notification, and how it's been very customer focused and patient focused type of pathway. All right. So before we start designing this pathway, it's important to just put the requirements here of a pathway, so we follow a little bit of rules, because all pathways, are not built from scratch. They're really designed for customers, right? So for the demonstration, the requirements that I'm going to put today is we're going to do a pathway for a surgical health service. This service has got multiple types of procedure they want to include in that pathway. So that means it's going to be documents for different type of procedures. It's going to be as well documents specific to certain doctors in those different type of procedures. We're going to design something that's going to be pre-admission focused only. And we'll say as well, there's going to be a COVID screening, a health assessment, and there'll be a one-question survey for the admin staff to ask the patient if they're happy with the admission date, admission time that's been given to them and notified via the system. All right. All right, let's start the journey. So first, right, I've got this area here. You can see, I'm not going to explore all the part of Personify Care, but what we'll see today is called the pathway editor. And it's very simple as clicking on the new pathway button here. And let's give this pathway a name, pre-admission. There we go. And create this pathway. Now we have a pathway name. We can actually start creating different activities. So the first thing is that I've already done a little bit of the work of digitizing the assessment of this pathway, right? Usually what we get is the customer sends us their PDF or a scanned version of the paper of the form that's being sent to the patient, and we'll create a digital version of that assessment. And in my pathway, I will schedule those assessments that I already have in bank. So the first one, actually very nice with this, I can pick here. Let's say that's the patient details assessment. This activity type is an assessment. So now I can actually pick from a list of assessment I've already digitized in here. I'll go through all of those little aspects that you can see here, the schedule and the condition in a minute, but simply so far now I'm going to just pick from my list of different digitized forms and schedule the patient admission form. click Save here. Now, first activity you can see on the right here, this is what the patient will actually see in their checklist when they complete this form. And they'll simply write, you can see that actually we have a address question. What is your address? In here, we can pre-fill address based on, entering the patient, start entering their address, and then we can suggest an address and it will fill out all those area for them so that your address is actually standardized across all your patients and it's very clear. We also have other type of question, right? It could be here, we want the patient to only enter phone number, right? So there's only a certain number of characters and type of characters that can be entered, no letters, only numbers. It could be, other type of text forms, or it could be radio buttons or checklists or something like Medicare card number for Australia that is standardized. So the data is as clear and as standardized for all your patients in one go. But those different, response type, they allow us to create pretty much every form that exists out there and make the data as well much better than when it's actually written by the patient. All right, so you understand that. Just let me know if you have any question on this part. What I'll do is I'll add two other assessment here. We got a COVID screening that will add to this list. Assessment, and I'm going to look for my COVID screening. That is probably just here. All right. And then we have the other requirements as well that admin staff wanted to ask the patient to confirm their attendance, confirming your attendance. And this is the title that the patient will see in their checklist. So I'm going to select that from the assessment list as well. Confirm your attendance. There we go. All right. So basically, we got 3 different surveys that will go to all patients at the moment currently scheduled there. Now, I want to add a few alerts, right? Before going into a little bit more details, now we look at the survey first and say like, all right, we talked about this a little bit earlier. We have a COVID-19 screening. I actually want to only look at the patient that have specific clinical risks regarding the COVID-19 screening assessment here. So let's put a few alerts. I'm not going to go in the exercise to put all the alerts. I just want to give you a good understanding how easy it is. But now I click on this activity here. I've got all the questions from the assessment in there. You can see as well at the moment that each of those questions have been given a specific value, right? And this is being set in the assessment builder. And that means that with this feature, we can say, right, we can give a scoring for the overall answer of your assessment. But at the moment, I'm just going to create a few flags to say that I want a flag maybe when the patient says, yes, they've recently been tested to COVID-19. So I'll use my edit activity button here. And now I can just hover my mouse over the yes answer and select which type of alerts I want to set up with that answer. At the moment, I'll set up a red flag. And the system automatically creates the red flag alerts that you can see here, right? Now it says flag yes on that specific patient answer. I'm going to save this, right? And now we can see in the alert section, we can verify that this alert's been well set up. Please flag your red flag when the patient says yes to that specific question. All right, the exercise of setting up flags is very easy because at the end I can just come here and say, yep, let's put a yes on this one, and let's put another red flag on the no for this one. Whatever the need for the clinician, we let our clinician do that themselves before going live because they can set up their own clinical risks. Now, the next thing as well is with this COVID screening, actually, in the process, this patient, might be invited, 2-3 weeks before they're actually coming from their appointment or the admission date. I actually want this COVID screening to be sent 2 days before the procedure date. So I will change the scheduled activity here to say I'm going to change this to let's say 2 days, right? And selecting the date here when I want to send this. At the moment, right, we get registration and admission date, but our system is very customizable. We can create as many dates and many interaction points or dates that a customer need. And we call it admission date now, but it could be consultation date, it could be appointment, it could be randomization date for clinical trials and things like that. So this is going to be scheduled before admission date, 2 days, and I'm not going to set a time. If you don't set a time, the system actually will decide when is the best time to be sent for this patient based on our data. And it should, select, especially for this population, when it's the best. So I'm just going to click save now. And you can see now that this COVID-19 screening is scheduled 2 days before admission date now in my pathway. Now, before going a little bit more in details, I'll just finish with this COVID-19 activities. I've mentioned before that, a patient digital pathway actually is different interaction over time, right? So the patient registers to Personify Care, and their journey might last 1 week, 2 weeks, 3 months, 1 year, 2 years, whatever the need of a customer. But now you actually want to remind the patient to come back to their account to complete those activities that are required for them to complete over time. And so we give our customer control over those messages and notification, right? So let's create a small notification for this COVID-19 activity so the patient knows to come back to their account. And we have the message tab here. And then create something very simple, but we also have the ability to actually personalize those messages. So I'm going to say, hi, first name of this patient, and the first name will be individualized to each very patient. Now we can select from the smart tag area below here. So I'm going to open this up, and I want to introduce here one of those data points, which is going to be first name at this point. Hi, first name. Please log back into your account. And we want to give them a link right there by SMS that they can click on. That brings them back to their account, right? And I introduce this here with the link. And then, of course, I want to put a signature so the patient recognizes those SMS. And we also have the ability to actually send all those SMS from, a specific title in Australia. Say, like if it's Hospital A, the SMS will come from Hospital A instead of a phone number. So click save. And there we go. We have a COVID-19 screening, your personalized message, and a specific alert for this survey. Thank you, Sarah, for joining us. I know you need to drop out. You can watch the recording after. There's a few more things in there. There are a few gems that I'm going to add in a few minutes. Thank you for coming in. All right. Now, we have a path, basically starting to be a skeleton of a small pathway. A few things in there as well that I'll show today is how to include, how to increase engagement with the patient, and how to include as well some of the documentation that hospital actually want to include in a pathway. So first thing is I'm going to create, and I always encourage and do this for our customer, to create a welcome message, right? The patient has done the effort to actually create an account. And now the first thing I want the patient to actually see when they come into their account is a welcome message that is, warm, and it's going to encourage them to come back to this experience. So I create a title with a nice little emoji in here, and I'm going to put some text I already have prepared. Dear, and in here I'm going to put the first name as well, dear first name, and a little bit of text in here for them to read. Of course, I want this welcome to be the first activity they're going to see in their checklist. I'm going to drag this at the top there. That's done. Let's have a look at what it looks like. This is what the patient is going to see. Now, I always encourage our customer to actually put as well a very nice, beautiful picture at the beginning. Could be a picture of the team, could be a picture of the hospital. So, and I'm going to include here a picture of a hospital actually that hospital is using on their website. So to input picture and images to Personify Care is very simple. The system accepts any picture that's living on the web, right? So if it's in the cloud, the JPEG lives on your website. That means that this JPEG is owned by the hospital, the copyright is owned by the hospital. It's also hosted by the IT team in the hospital. Then you can simply take the hyperlink from your website and use it right away in Personify Care to input picture. So I'm gonna just put a picture in here from one of our local hospital that's live on the web. And you can see here that already is like, wow, this is already a little bit more appealing for the patient. It feels that it's beautiful. And although here you don't really see the mobile experience, I can invite you to do the mobile experience and see what it looks like on your phone later. All right, so that's our first welcome. Let's create now a specific consumer information document for, let's say, an endoscopic procedure That's going to go only if the patient has, a GI procedure for Dr. John Doe. All right, very specific and very common. In this situation, we might have like 10 different type of documents that goes to different doctor with different procedure. Let's create one for an example. All right, so I'm going to create a new activity in here. Just copy my title from my little document here. All right, preparing for your endoscopic procedure. And now I'm going to copy some text that I've pre-prepared in here, and we're going to go through a little bit what it looks like as well for the patients, just to show you the different options. So I'm going to click save on this. Thanks, Katie, for joining in. It's been a pleasure. And yeah, we'll send you the recording. We'll watch later. All right, so I've just created preparing your endoscopic procedure right here. So let's have a look what it looks like. So in the documents, in the content, I've just put a link that I've taken from YouTube. This is a link from the Australian Commission on Safety and Quality in Healthcare about colonoscopy procedure. Some customer actually using this link for their patients that's available online. And that's easy, right? In the activity, you can see here, that's the link that we take directly from YouTube when you say share, and you have the link there. Put in there, the patient can watch it within their Personify Care account. I've also put a few more things in here, right? So we're going to have a look. So at the bottom, right, we can hear a hyperlink. When the patient clicks on it, actually patient would download directly the PDF into their mobile or computer to have a look at this PDF within their device. But we also have at the bottom here a PDF that the patient can have a look within this specific Personify Care activity. We can see here about bowel polyps. And they have a little next button here that you can actually read this material. So you know that when the patient actually looks at this, you will have a proof in Personify Care the patient has consumed this information. And you know that the patient doesn't have to do any more exercise to have a look at the information. Where is it? Is it on another website and things like that? They have it right there available in their account, and they can come back to their account to consult it as well over time in the future. All right, so that is a endoscopic procedure. Now the last part of this is actually said, I want to condition this to very small amount of patient that want to see it. Not every patient will see this, right? So this will probably go, let's say we're going to schedule this with the COVID-19 screening 2 days before admission. And I'm going to set some specific condition, only include if, and you can see here, there's a number of variables that we have designed. So as said, like the other admission date, we can also design as many different variables that fits our customers' needs. It could be procedure, it could be anything that you actually want to segregate different categories of patient. At this moment, I've created procedure type. So let's say we'll schedule this for GI procedure 1. And we'll also say that only on the condition that this goes for a doctor, and we have a list of doctor here. Let's go for Dr. John Doe in this situation. That easy. So now we have the condition that this will only be sent if the patient actually filled those conditions. And those conditions, especially when they're a little bit complex, they're actually entered by the admin staff when they're inviting a patient to Personify Care. So I'll show you at the end the registration page that shows, how you invite a patient. And at this point, those data points are entered so that the correct patient gets the correct information. Any question regarding this part so far? I know I'm going quickly and sometimes some people need to leave. So I'll take just a few minutes and then I'll finish with our last activity, which is probably one of mostly useful activity to remind the patients to come to their admission details. So far, very clear. Thank you, Sam. All right, very good. So don't hesitate to stop me. The last activity I will create, and this is something that almost 100% of a customer do, is actually to let the patients remind them that they're coming for admission or to a procedure or to an appointment at a specific time to try to decrease cancellation and decrease no-show, and as well sometimes increase rebooking if the patient cannot attend. So I've got here the admission detail information, and I'm going to copy from my little cheat sheet, and we'll have a look what is going to be in this activity here. There we go. I'm going to copy this in the contents and I click save. And this is also going to be sent with the other lot of activities. So at 2 days before admission, the patient has got a few things to complete in there. After admission dates, right? And that's going to go to every patient. And let's have a look at this admission detail information. So in here, right, we're including that specific admission date and time that the patient is supposed to come. And because every patient's got this data entered into our system, we can feed it back to the patient at opportune time. So they are notified that they're supposed to come here, right? We also include a phone number here in case they need it. We've got a little bit of fasting instruction. So because we have the surgery time maybe entered in our system, we can say we can do intelligent things like such as giving a time that is surgery time minus 6 hours. For the patient, this will be changed to the actual time that this represents, right? If it was 10 a.m., then this would show 4 a.m. for this patient. And then in here as well, right, including locations, click here for Google Map direction. The patient can click here within a mobile, and this will open Google Map, which is used by mostly everyone to get the direction directly to your hospital. And an image of the map just for those that do not use those systems, so they can help out a little bit orient themselves, right? And then same thing here, we have multiple locations. We can create as many different of those activities depending on the location that are entered into our system. All right, and I think this already gives us a good understanding of a basic patient digital pathway for pre-admission experience. Now, of course, we had very few things to complete here. We could add many more different alerts. We could add alerts for different teams, right? Alerts for administrative team and alerts for nursing teams that have different workflow to be done. And then in our dashboard where the patient actually are and raising some flags, the different teams can actually find those alerts and say, hey, here's my to-do list of patient I need to follow up, either sending a new admission date if I'm admin, or it's reviewing the health form if I'm a nurse. And so that means as well, with those two teams also work by exception and working in the minority of patient actually raising some specific flags in there. Steve, have to go, G, but are there any customer in public hospital in Queensland yet? Very good question. In Queensland, we do not have any public hospital in Queensland live at the moment. We have public hospital in SA and in Victoria. And but we have hospitals in mostly all of the states and clinics in all the states, but not specific to Queensland now. I think as well, don't hesitate if you have any other questions. To me, this concludes the practice part of this session. So I want to thank you all for assisting today, for your precious time. I'm just going to go back as well, though. Don't forget yet, we'll send you the recording very shortly. And let's have a look if there's any other question or Q&A. Michelle, I've been involved with focus group. There's a sense of being against a process that's out of their control. There's a strong perception that a pathway is a cookie cutter concept, but the versatility and clinical involvement in design of this is a huge selling point. Yes, thank you very much, Michelle. I think most of our customers as well starting to actually involve consumer at the design part, right? So the consumer can actually give it a go before they go live and give some specific feedback. Most of the feedback as well we get from consumers, not that much from the system, but from the patient experience that's been designed there by the clinician and interaction points and messaging, tone and things like that. And I think that's definitely something that needs to be done and involved with the testing part. And you can see here that it's very easy to test, right? So before you go, please send me your mobile number if you want to try this patient experience that I just created now. I can send you an invite in the next 5 or 10 minutes, or you can contact me via email as well at info@personifycare.com, and I'll invite you to that specific experience that you've just seen there. That is very easy to try, so that gives you good perception in terms of how do you actually create an account in there and things like that. And don't hesitate, yes, to reach out for any other purpose at info@personifycare.com. A big thank you to everyone today, and I hope I see you again for our next masterclass, which we haven't announced the date yet, but will come probably next few weeks. All right, I'm gathering some mobile number here. I'm going to copy them and invite. Oh, the last thing I think that I haven't shown you the registration page. So this is the simple registration page here. Each registration page, right, is specific to the customer because of their data needs in here. But it's as simple as that: entering a mobile number, a URN if that's something you want to collect from the invitation. Now in here, I'll include some first names so that the invitation message is individualized to your first name. And then some of those fields in here that decides when you use your admission and your doctor and procedure and things like that. But as I said, this is completely customizable and really fits the customer needs for each different type of pathway, whether it's research or clinic. Is there a clinical dashboard to view patient? Yes, I can show this quickly here. This is all mock patient, but this is one example of a dashboard. Also, this is totally configurable. So all the column names can be changed in here. We can actually show the data that you want and you're holding from your patient in here. But mainly you got the flags as well. You can see the flags on the side here. I click on a red flag. That means it's going to show all patients with a red flag raised. That would be like my checklist if that is, a nursing red flag is being raised. But the dashboard is mainly this, right? And you can dwell into a little bit more details about the patient account in here, where you have, what they've completed in terms of questionnaires, what's their activities over time, put some nursing notes in there. We got a complete audit log as well, what the system has done and other clinicians have done with this patient, and flagging system here to clear and raise up flag for the patient in here, as well as messaging platform. We might go into more details for the next masterclass within that, but I can actually show the workflow as to, how can we save time with flags and things like that. So stay tuned about the subject and what's going to come. But I think it's going to be a good idea. And if you have any suggestion right now about what we should be talking about at our next masterclass, because it's not clearly defined yet, and we'd like to have some consumer feedback about that, that'd be great. Q&A a little bit. Is there clinical dashboard? That's been addressed. Thank you. Huge selling point. All right. Well, if that's all, thank you very much for your time. I think we will stop this masterclass there, and I will send a patient invitations to those who have shared their mobile now. Thanks. See you all.